This is a short video presentation on one recent, important evidence summary completed by the HSE Library Evidence team. The question concerned the best available evidence on the potential benefits and/or harms of the administration of antibiotics by general practitioners or other healthcare professionals to patients with suspected sepsis prior to hospital transfer. The question was submitted by a group considering recommendations of the former Chief Justice Clerk investigation into the death of Aoife Johnson at University Hospital, Limerick, under the auspices of the HSE CEO. Specifically, the group were considering whether administration of antibiotics to all suspected cases of sepsis by GPs or other healthcare professionals prior to arrival at a hospital emergency department might improve sepsis outcomes, or, equally, might result in unintended harms, such as antimicrobial resistance. The HSE Library team used nested knowledge to gather together in one place all of the elements of the evidence summary, formulating an answerable question and subdividing the question into PICO components to help focus on a specific patient group, a particular intervention, or potential comparator interventions, to help achieve improved patient outcomes. Collating all of the literature search results and search strategies. Screening search results according to defined inclusion and exclusion criteria. And, finally, extracting the relevant data from included studies and tagging these studies to help identify the most important findings. Here, we can see within the nest for this question the agreed question text, the PICO, all of the various sources searched, as well as all of the individual search strategies for the main databases, Embase, Medline, and so on. Saving the search strategies in this way makes it easy for colleagues to see exactly what was searched and how we searched it, to pick up where another colleague may have left off, or to return at any point in the future and rerun the search. Here we can see the final list of included and excluded studies, as well as the tags applied to each of the included studies. These tags capture the most important findings that we want to set out in the final evidence summary. Once we had agreed on our list of included studies, full-text transcripts of each of the included studies were uploaded into the nest and shared with the sepsis group for further critical appraisal and data extraction. Here is a sample of the full-text transcripts included in the evidence summary. Nested knowledge allows us to automatically generate a Prisma flow diagram to document in a transparent manner all of the activity associated with the literature review. So, in this case, what were the findings? We found that the majority of sepsis is community acquired, and that yes, the ED and primary care are important targets to improve recognition and early management of sepsis. A substantial reduction in the burden of sepsis-related disease requires action across the entire healthcare system. One important recommendation from recent NICE guidance is that in remote or rural locations, where transfer time to ED is routinely more than 1 hour, GPs should have mechanisms in place to give antibiotics to people with suspected sepsis who meet high-risk criteria. We specify the high-risk criteria in the evidence summary. We found that pre-arrival notification to the ED of suspected cases of sepsis, pre-hospital sepsis alerts, by emergency services personnel may reduce time to sepsis core measures and improve clinical outcomes. Another interesting finding is that in patients with varying severity of sepsis, Training provided to emergency medical services personnel in the recognition of sepsis improved early recognition and care in the whole acute care chain. However, giving antibiotics in the ambulance did not lead to improved survival, regardless of illness severity. There is a lack of high-quality evidence for a one-size-fits-all approach in respect of treating everyone with suspected sepsis with antimicrobials within an hour. The NICE Update 2024A aims to ensure that the sickest people are attended to very quickly, but that clinicians take a little more time to diagnose those that are less acutely ill and to prescribe an appropriate antibiotic rather than a broad-spectrum antibiotic. The principle of individualized dosing should replace the principle of standard dosing, that re-evaluation of duration and appropriateness of treatment at regular intervals is required, and that de-escalation and shortened courses of antimicrobials must be considered for most patients, except in some justified circumstances.